The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are looking at children's health challenges from a different perspective, one that includes critical thinking, and we're not afraid to give you the honest truth. My guest today is Dr. Peter McCullough. He is the world's, I would say probably one of the world's leading cardiologists, certainly most published, and also expert on COVID. What I'm excited about for today is we're going to discuss his McCullough Foundation report called Determinants of Autism Spectrum Disorder. This is a 52-page, 308 reference document with massive supplemental material. It's a masterpiece. You're not going to want to click out of this episode. This is going to be amazing. We're going to deal with the elephant in the room. Welcome to the show, Dr. McCullough.
Well, thanks for having me.
You're also the author of Vaccines, Mythology, Ideology, and Reality. Thank you for writing that. I am so grateful that you decided to tackle the autism and the possible vaccine connection topic. It's such a big one. How did you get into doing that? I'm just curious.
You know, I had never considered the connection. I didn't think much about autism. You know, I went to medical school in the 1980s, and I remember in the Green Merck manual, there was just a page or two about what's called autism and mutism. That was it. There really wasn't much about it. I actually never went to a lecture on autism throughout my career. But through the COVID-19 pandemic, it started to become more aware, certainly in my circles, that we had an epidemic of autism, that it was on the rise. I had no idea it was rising at the rate it was. I began to see autistic patients in my practice for the first time. I had somebody as old as 80 years old. So obviously, he's had it for a very long time. And then lots of young people, teenagers and young adults. And so, as the data came together, the CDC is reporting, an asymptotically rising rate of autism. CDC says 27% of it's profound autism. I had a profoundly autistic person in my office the other day. I started to think, wait a minute, something is going on. I'm an epidemiologist. Genetics don't change that quickly. The environment, in terms of air, food, and water, has not changed that dramatically. Something is up. And at the McCullough Foundation, we responded to a request for applications to study this in detail.
Thank you for that. You are absolutely right. I've always felt, as a pediatrician in the trenches for 35 years, we went to school at the same time. I didn't see autism when I was a child. I didn't see autism growing up. I didn't see autism when I was in medical school. I only saw a few cases in residency, and then it just exploded starting in the 90s and 2000s. Yeah. What did you find in terms of prevalence? What's happened with the prevalence of autism in our country?
Well, it was about 1 in 10,000 in the 1960s. It's now 1 in 31 as of 2022 from the CDC Autism Spectrum Network. Now, this is important. This is a CDC network. It has 16 sites, and it carefully chronicles autism being triggered by basically automated coding, but also special needs. So it knows that the children who really require special needs at school and elsewhere. And the CDC keeps track of this. It's been going on for over 20 years. And, the lowest rate of autism is in El Paso, Texas, at their center there. The highest rate is in California. So it's not equal around the country, but 1 in 31 nationally, 3.2% of all children, 27% have profound autism, meaning severely mentally impaired, cannot communicate with their parents, can't navigate the bathroom independently, and need essentially round-the-clock care. So it's on the rise. There's no doubt about it. The inflection point, by the way, we think actually is right around 1986 and going forward. Yeah. Yep.
I saw that. The data that you're quoting, the 1 in 31, is actually data of children who are 8 years old. So these are kids who were born 8 years ago or now 10 years ago.
Yeah. And Paul, also in 2022, So the data are in arrears. So the CDC publishes this in 2025, but it's from a data cut point in 2022 of children who arrive at the 8-year mark.
Right.
Can you imagine where we are now with those many children? The autism doesn't go away. Can you imagine where we are now in 2025?
Right. And the clue to that was the California data also showed 1 in 12 boys who were at age 4. So that gives you a clue that there's a wave still growing and coming towards us.
Oh, for sure. It's a tidal wave, and you can see it in everyday life. People who seem to be withdrawn, they can't look you in the eye and communicate. You see them as ticket takers, waiters, waitresses. I now have developed a keen eye to try to identify people who have autism spectrum disorder. And it is a spectrum. There's no doubt about it. And it is an overlap, Paul. There's an overlap of about a third of those with autism also have a diagnosis of attention deficit hyperactivity disorder. And since 2013, the DSM-4, I believe, allows kind of co-diagnoses. Now, it turns out about 8% of ADHD has autism. There's also an overlap between autism and epilepsy or seizures, and then involuntary facial movements called tics, or they can be arm and leg movements as well, tics. So autism spectrum disorder is a neuropsychiatric disorder that has overlap with other syndromes, or those other syndromes are part of the autistic syndrome.
Yes. I had an experience in 2003. I was at a conference just on autism with a expert panel of about 10 experts. At the end of the conference, the question was asked, and the panel went down and answered one by one. The question was, is ADD and ADHD part of the spectrum? And every single expert said absolutely. And one of the reasons they would say that is that as they were doing creative things to try to help the severely autistic kids recover, and they were having some success, but almost invariably, kids who were recovering would either get stuck at ADD, ADHD, or they would pass through that phase. So it clearly appears to be part of the spectrum.
There's some other subtle behaviors, but maybe we can talk about them a bit. One is to not only be withdrawn, but tend to gravitate towards computers. I have a lot of autistic young people. They tend to be night owls. They tend to play video games all night long, very interested in virtual reality. During the day, don't do much. Autistic children who almost never play in sports. They just don't. Really trouble with dating later on. And many, I saw one recently in the airport, many actually have GI disorders or even forms of malnourishment. So you see a pale-looking child who is like 6 years old wearing noise-canceling headphones because of the hyperacusis. You can almost be certain that child has autism.
Yeah, agreed. I've been as a pediatrician, I was starting to figure out at a very young age who is starting to head down that road. And one of the first signs I noticed was the eyes. Kids' eyes were sort of becoming blank stare or avoidant. So they won't look you in the eye. And so I call it vaccine eyes. But you can just look at babies, you can start to pick this out. Let's pivot now, because I think that one of the most important things for our viewers is, okay, we understand we have a problem. This is epidemic. It's tragic. If we're going to do something about it, we need to understand what's causing this so that we can have a chance. If you're a parent, you want to do everything in your power to hopefully avoid your child having to go down that path.
Yeah,
I know you did a super in-depth study of the causes of autism. What can you tell us about your findings?
Well, the first is the epidemiologic approach, Paul. So the important point here is for a complex syndrome like this, there's never a single cause. There never is. Just like heart disease is complex, cancer is complex. And they're equally complex. There's not a single cause of cancer, a single cause of heart disease. So we took the approach of analyzing risk factors. That's the fair way to say it. So people say, well, this causes autism. No. It's risk factors, just like we don't allow absolute statements about what causes heart disease. Around that circle at the top of this McCullough Foundation report, which as you pointed out, this is the most comprehensive document on autism that exists as a scientific document.
Absolutely, and thank you for that.
By far. We point out that, so for instance, there are common genetic variants. And they're so common, we don't know if they really play a role or not. So, for instance, the MTHFR, the methylene tetrahydrofolic acid reductase polymorphism, of which nearly all Irish Americans have, like me, that's a common one. And there are some other common genetic variants. So those are legitimate. There are almost certainly risks with having a premature baby, that is a baby before age 37 weeks, and older parents. So men over 40, women over 35. It's just, again, it's a risk factor. There are in utero exposures of drugs, and we looked at this carefully with the recent press conference by Trump and RFK and others. But the big ticket ones that we found were anticonvulsants, antidepressants, antipsychotics, and perhaps opioids. But it's not taking a capsule of Tylenol, Paul. I really do think that Trump and RFK and Macri and others misled the country on this. When drugs affect the baby's brain development in utero, it's drugs given every day, and they actually impact synaptic transmission. Let's say an SNRI drug or an antipsychotic drug. And so if the synapses in the baby are affected day by day by day, the brain can actually have abnormal development. It's not because mom had a headache and took 2 capsules of Tylenol. And so we looked at this carefully. Just on Tylenol, there's a very, very important study by Altquist published in JAMA in 2024. They had 2 decades of detailed Tylenol data, first, second, and third trimester, what they took the Tylenol for, what other drugs that women took Tylenol for. And they even had siblings. This is very important, where the same mother, same father had a baby. In one pregnancy, the mom took some Tylenol for something. And then in another pregnancy, didn't take any Tylenol at all. So we had this, that's the best study by a mile. And for sure, Tylenol is not independently related to the development of autism. I want people to know that. It's not. American Society of Pediatrics and Obstetrics Gynecology, they're all correct. And Trump and RFK and Macri and Oz, they were all wrong in putting it out there. And that was, if I was on the team with them, I'd say, full stop, everybody. It's just, we don't want to mislead the country on this. That, there's theoretical concerns about glutathione regeneration and other things in the setting of a Tylenol overdose, not when mom takes 2 capsules and the liver quickly metabolizes it and what have you. It's in and out of the baby quickly. It's in and out of mom quickly. So,
yeah, my concern with Tylenol was just the fact that it's magnifying the toxic effect of all toxins, being that it's blocking the production of glutathione.
I know, but listen, it's in and out of the baby so quickly. There's lots of glutathione is not a standalone antioxidative pathway. There's so much redundancy there. I can tell you Tylenol is having zero effect. The concern would be confounding, and that's what Altquist showed. So for instance, if you consider the women taking Tylenol who also are taking antipsychotics and opioids, then sure, yeah, women who take Tylenol, there is an increased rate of autism. Yeah. But it's not the Tylenol. They're taking a lot of other drugs.
You've looked in this wonderful paper of yours, you've looked into the vaccine issue, and I'm going to have you talk about that. But pediatricians will tell parents, give Tylenol before you come to your vaccine visit and give it after. So
okay, well, hang on. We examined that, and I think you have something there. I think both vaccination during pregnancy. Now, remember, when our wives were pregnant decades ago, there were no vaccines. Vaccinating pregnant women is a new thing. It's not time-honored. Pregnant women are routinely told to take Tylenol before vaccinations during pregnancy because the vaccine could induce fever and inflammation, and the woman could lose the baby. So that's the reason why. So I think Tylenol in that circumstance, I wouldn't say it's the Tylenol, but it may be the impact of vaccination during pregnancy, of which we did not have good data to examine. And then in the child, we were able to find some evidence that if a child takes a bundle of vaccines and takes Tylenol, that the Tylenol seems to have an amplified potential risk for autism. But it may just be the availability of Tylenol in the household as opposed to Tylenol and ibuprofen. We couldn't find a signal for ibuprofen, but we thoroughly examined this issue. It's best for pregnant women to take no drugs whatsoever. Let's just put that out there. But if there's a fever during pregnancy, I think it's a mistake not to treat it. The woman could lose the baby, and Tylenol is indicated.
Gotcha. I wanted to just clarify one thing. You talked at the beginning on causes of autism, mentioning polymorphisms. These are genetic glitches, as like I call it, keep it simple. It's a glitch. It's not hardwiring like Down syndrome. It's just a vulnerability. Can you explain that a little more?
Right. Well, not only that, but we're talking about common variants. Common variants means they're in probably 5 to even 50% of the population. Like let's say MTHFR, which is in 25% of the population. It's well over 75% of the Irish American population. So, it can't be something that's so common like that. So they're common variants. Now, here's the concept, Paul. What I've just laid out, we haven't gotten to the vaccines. Everything I've laid out could predispose a child to, in a sense, be triggered to develop what's called encephalitis or brain inflammation with vaccines, and then the post-encephalitic autism. So what we've talked about is not a waste of time. They may be premature factors. So let me be more specific. If a child born to older parents, and that was born, let's say, at 33 weeks, I would say, wait a minute, this child, is at enhanced risk for autism, and I think going into a standard vaccine schedule could be at extraordinarily high risk of developing autism.
Agreed.
Do you see what I mean? So it's
Yes.
this predisposition. The baby, when the baby left the hospital and made it through the NICU and is fine, the baby probably would have been fine with no
Had they not
vaccines whatsoever.
vaccinated. Yep.
Yeah.
Now, we've seen that so many times. It's
Yeah.
just tragic. The nurses in the NICUs know this. They have watched time and time again where they were being told to vaccinate a 2.5 kilo premature baby once they were at 2.5 kilos, and that baby would stop breathing. It was there on.
Paul, I'm glad you brought that up. There was a recent randomized trial in JAMA that demonstrated exactly that. So there's an important implication. So if premature babies are vaccinated on a premature schedule, then there's increased apnea in the hospital.
Right.
So what does this tell you at home?
At home, apnea is death.
Yeah, well, that's it. If the nurses weren't there to revive the babies in the hospital, if this would have happened at home in the cradle or in the crib, then the parents were sleeping. It would have been a sudden infant death syndrome.
Yep.
And there's a very good paper by Miller examining the VAERS data that's found exactly that. The large fraction of sudden infant deaths occur right around a big bundle of vaccines.
And right after, not before.
Yeah, that's very important. Right after, not before.
Yeah.
Now, I want to point out one other risk factor I failed to mention, but again, anticipating who could really be in trouble with vaccines, that is a child born who already has a sibling with autism.
Yes.
Right? I mean, so you could lay out scenarios now of very high risk children who don't have autism, and they probably would be fine with no vaccines. But when they get a big bundle of vaccines, watch out. They're going to convert. They're going to develop what's called encephalitis or brain inflammation. And we do believe autism represents a post-encephalitic state. 20 vaccines have in their package inserts that the vaccines themselves cause encephalitis or brain inflammation. So why wouldn't we think that there is a brain inflammation that occurs, whether clinically recognized or not clinically recognized, and then the post-encephalitic state? That makes sense. That's the reason why there's tics, and that's the reason why there's seizures. So seizures are characteristic of a post-encephalitic state.
Yeah. No, you're absolutely right. Your paper showed a 5 to 10-fold increase in autism spectrum diagnosis for kids who had an affected sibling. I mean, I had so many families join my practice when they were kicked out of another pediatric practice because their first child was severely autistic. They didn't want to have that experience again. They didn't want to vaccinate subsequent kids. And unfortunately, the American Academy of Pediatrics has said it's okay to kick those families out. And they would end up in my door, and I would hear these stories literally hundreds of times, these parents weeping about what happened to their first child, and they didn't want to do it again to their next.
Hey, Paul, there was an important vignette in New England Journal of Medicine recently, and the vignette was an African-American child who already had a sibling with autism. And the parents were from outside the United States. I don't know if it was Caribbean or Africa. And this child, I believe, was, I think, 4 years old. And the child had had all the vaccines, from other clinics, except for the MMR vaccine. And the parents were concerned about the MMR vaccine and its connection to potentially autism. They already had one child with autism.
Mm-hmm.
So the vignette asked the doctors, with this scenario, would you accept this patient into your practice? So, I answered it because I wanted to see what people said.
Right.
Turns out a third of doctors said no, kick him out of the practice.
Wow.
Yeah.
Yeah. And that's a highly vaccinated kid, but they wanted that kid to get the MMR as well.
Right.
Yeah.
Right. That goes to show you. And some of the answers were these unfounded things. Oh, I don't want this kid bringing measles into my clinic, and I'm not going to take responsibility for this, and on and on. So people have this completely unscientific, ungrounded fear of these infectious diseases. It's no better exemplified than by the editorial in New England Journal of Medicine that appeared this week by Mandy Cohen. She's the former CDC director. And she said, listen, she doesn't want to see any of the states reduce vaccine requirements whatsoever. She says, if that happens, immediately all these diseases of yesteryear are going to come back: diphtheria, pertussis, measles.
Oh, please speak to that, because it's something I speak to a lot, but I love your take on things as an epidemiologist.
Right. And Paul, she says that, listen, this is all going to come back. These diseases are, in a sense, hiding between, beneath people's beds, and they're going to come roaring back. It's amazing that she wrote this. And, in our book, Vaccines, Mythology, Ideology, and Reality, we have this mythology. And the mythology is that, mankind is vulnerable to these infectious diseases, and that we're going to be stricken as soon as we lighten up on vaccines. But what Cohen doesn't point out, we do point out in our book, is, listen, diseases for which there's no vaccines, bubonic plague, rheumatic fever, syphilis, and tuberculosis, they've all come under control with no vaccines.
Right.
So obviously sanitation, screening, detection, and treatment play a huge role. And this idea that a disease is vaccine preventable only and, implicitly untreatable is just wrong. So Cohen and her co-authors are just wrong on this. I mean, pertussis, I would never worry about that. It's a treatable illness. I've never even seen a case, I think, because of rapid treatment.
Can you quickly summarize? You looked at 136 vaccine-related studies. 29 found neutral or no association. 107 did show a possible link. Maybe just explain a little bit about what you found.
Right. So let's take the neutral one. So this was our finding that essentially was the impetus for the CDC to take down their statements on this on the website. We published this October 27th, 2025, had a press release. It was made big news everywhere. It was about 3 weeks later, the CDC in the middle of the night changed their statements on their website. And what we found of these 29 studies, and a lot of them actually were papers written from one data source, which is the Danish cohort study, is that they all had contaminated control groups that had taken vaccines. People had written papers saying, listen, it's not a clean control group. But on top of that, these papers, unlike you, Paul, in your paper, they never examined the children. They never directly examined the vaccine records. They never talked to the parents, none of that. And so they made what's called a type 2 error. A type 2 error is failing to find an association indeed when it's there. Now, it turns out the other, 106 studies now all, are finding a link in some way. Mechanistically, the case series are very, very convincing. Your study very convincing. In fact, we found 12 studies, like the Thomas study, that demonstrate a healthy child born today remains healthier if they receive no vaccines whatsoever. And so this
I have to repeat that. A healthy child born today remains healthier if they don't take vaccines.
Right. This is a key finding. And, people have been out there in the health freedom community. I have to mention, we're on the CHD network. People said, well, Dr. McCullough, I've been saying this for years. And I said, I know. The activism of CHD and ICANN and the High Wire and Texas Vaccine Choice and Canada Vaccine Choice, the activism has raised awareness. But we think what's really getting this over the finish line is a high-quality scientific report. And so what I've said publicly is I said, listen, the CDC with 12,000 employees and a $9 billion budget, they should do their own report. And it ought to be every bit as good as ours or better, and let them do their own evaluation. Now, recently with this challenge, Paul, the WHO came out with their report. They examined roughly half of the papers we studied, and they said, well, we still can't see anything here. And immediately the WHO report was dismissed because it's not complete, it's not extensive, it's not authoritative.
Right. I feel strongly that we have electronic medical records today. Any large health system could go in, pull out the unvaxxed, age match, socioeconomically match those to vaccinated kids, and look at all health outcomes. It would be highly revealing.
But Paul, I would say with the amount of money spent in public health, every single family should be examined and interviewed. Listen, we do this for heart disease. We do this for cancer. We don't rely on automated databases. This is an important step. And people have said, oh, the recent Henry Ford study or other studies, what should they do? I said, listen, it's a starting point. Now let's call in the parents. Let's examine the children. Let's do very careful studies, directly examine the vaccine record, and start to do some high-quality research. I almost feel like sloppy research has been done intentionally not to find an association.
Right. I agree. Couldn't agree more. I know you've got to go. You're in the middle of patients. Thank you for talking to us. Couple last questions. Should a newborn get a hepatitis B vaccine? I know the ACIP committee looked at this. And then secondly, your advice regarding CDC vaccine mandates and advice to new parents.
Well, let's take hepatitis B. And again, this has been miscommunicated all over the place. We have 3.6 million live births per year, Paul. We have 25,000 of those are in seropositive mothers or mothers with active hepatitis B. If a mother has active hepatitis B with a viral load, she gets an antiviral called tenofovir. When the baby's born, the baby gets hepatitis B immunoglobulin and gets the vaccine. And all that's appropriate to reduce vertical transmission. So we have good hepatitis B control over that 25,000 live births. By the way, 2/3 of the mothers come from outside the United States. Now, for the other 3.6 million babies, the right decision was made. No hepatitis B vaccine. None. That should be considered far down the line, depending on risks. I think if someone goes into healthcare or first responders, they probably should want to consider it. So, ACIP committee working at, a snail's pace has come up at least with one reasonable decision to drop this universal hepatitis B vaccine. It's simply not needed.
Yeah, sadly, just till 2 months, and then they can consider it in consultation with the baby's doctor, which unfortunately...
hang on. Mandy Cohen's editorial out in New England Journal of Medicine says, no, there shouldn't be any shared decision-making with the doctor, Paul.
Oh, so, she wants the doctor to have all control.
No, she wants the states to have all control.
Oh, even worse. She
says that if doctors get to decide with patients, it's going to confuse them.
Oh, dear.
Her editorial just came out in New England Journal of Medicine. We have a Focal Point Substack out on this. It is astounding what our former CDC director thinks.
Wow. I haven't read it yet. Yeah, that's astounding.
Yeah, in terms of the rest of the schedule, I wholeheartedly agree with states that are going to drop vaccine requirements and let it be the decision between the doctor and the patient. I think where we're going on this, Paul, is we've ended up with side effects from vaccines and some serious allergic and neuropsychiatric long-term conditions because of over-vaccination. If vaccination was more appropriate and risk stratified. So let me give you an example. A child with congenital asplenia or has had a spleen removed due to Hodgkin's treatment or ITP treatment, like my brother-in-law had his spleen removed, for sure they should get the vaccines for encapsulated organisms like pneumococcus, Haemophilus, and meningitis. That's fine. We should get to much more evidence-based vaccination. Let's say a gay or bisexual man, very high risk for anal cancer, should get the HPV, human papillomavirus vaccine. Do you see what I mean? So we ought to have a much greater degree of risk stratification and targeting the vaccines. I'd like to see that happen as opposed to just, this giant burden of vaccines borne by all children.
Yeah. And I would add to that, until they're properly safety tested with a proper placebo, looking at all health outcomes and looking for a long period of time, we have really no good science on the safety of what we're doing.
No, we certainly don't, but I think these principles we can observe. Vaccines are far safer if they're given individually than in combinations. We saw that with the very first seminal observation by Andrew Wakefield in 1998, published in The Lancet. And then they're far safer if they're given later in life.
Yes.
Later in life. I mean, much later in life. Yes. So would I worry about a HPV vaccine in a gay or bisexual man? No. I mean, it's far late in life. It's trying to give some modicum of protection. Does every teenage girl need this shot? No. And that's where we have problems. And Paul, if I can finish on a positive note, I just finished with a patient today, I'm so thrilled, who was vaccine injured. I believe it was from the HPV vaccine as a young girl. And sure enough, with the COVID vaccine, she developed Guillain-Barré syndrome. I mean, serious Guillain-Barré syndrome. In a wheelchair, very disabled, very high spike antibodies. I examined her. She had all the classic features. She couldn't stand up on her toes, what have you. And I've been working with her now probably about a year. And with McCullough protocol, spike detoxification, additional drugs, tapering off some psychiatric drugs. She came in today. She walked into my office and she spun around. She was able to stand up on her toes for a prolonged period of time. I was blown away and happy with recovery from Guillain-Barré syndrome. But I told her, I said, listen, you just can't take vaccines. They've got to stop.
Yeah. Yep. Well, congratulations on that successful story. Thank you for ending on a positive note. And I thank you, Dr. Peter McCullough, for your great addition to the world of autism and vaccines and that whole connection. Thank you.
Thank you.
So you can catch me on kidsfirstforever.com if you need coaching or other information. It's always great to be with you. Look forward to seeing you next week.
Hello, my name is Dr. Bonnie Bookman.
And what kind of a doctor are you?
I'm a retired nurse naturopath, so I had a natural health practice for 30 years, had a varied nursing background before that. And I'm here to talk about what I saw over the years. I had my first autism spectrum individual in my third year in practice with my doctorate. I had never, as a mother or a nurse or with my doctorate, seen such an individual, and it was really shocking to me. This was about 1994. And after that, the floodgates opened and they just kept coming, which forced me to take additional postgraduate work, contact hour trainings specific to Asperger's and autism. I learned a lot. I learned to help those individuals. It's important to note that each individual is in fact a unique individual. They are not all the same, just as none of us are. Some of them were truly profound, as in 26 years old and still wearing diapers, still smearing poop on the wall. And those are the children, they may be adults, but they're children who are not normally depicted in television and common media things, where we tend to see the children who are very intelligent and doing well, even if they don't communicate well. And in fact, I found them all to be intelligent. I also found it to be horrifying to think that these children were in there. They just had difficulty communicating back out. And it was such an eye-opener to me.
So many, many years ago, you saw your first case of
Yes,
autism and it shocked you.
Yes.
And now, today, wind up to 2024, it's
Yes.
everywhere.
It is everywhere. And, you know, we hear people saying, well, it's genetic. I'm sorry, we've had the same gene pool for thousands of years. You know, as a scientist, I believe perhaps there's a genetic predisposition, but something turns it on, and there could be a number of variables. I have to tell you, however, that at the end of my practice when I retired, I had 200 autism spectrum individuals, only 4 of which whose parents did not say that they were vaccine injured, that they recognized a dramatic change within them within hours, most of them within that first day to 2 weeks. There were 2 of those 4 children out of 200. So we're talking 2% whose parents did not come because of their belief in vaccine injury and simply wanting to have their child do better. 2 of those children had been given overdoses of an IV antibiotic, which is both neuro and ototoxic. They both did fairly well with early interventions. One of them did lose his hearing as well, so that was very well documented. The other 2 out of 200, one had genetic anomalies, wide orbital spacing, some chromosomal issues. I think they tagged autism on as a diagnosis so that the child could receive some extra services. And then the last child out of 200, his mother had a master's in nursing, and she was adamant that she was sure that medications didn't have anything to do with it. I have always respected the parents for knowing their child better than anyone else, and so I respected her views, and I did, however, question her. Was the child vaccinated? And yes, of course. He had 2 vaccines the day he was born. She said it was not vaccine related because he never had speech. But he had 2 vaccines the day he was born. So, and 2 months, 4 months, 6 months, 8 months. We will never know whether he would have developed speech. It's just incredibly sad what these parents have witnessed and gone through. It breaks your heart. It really does.
But you also believe that we can heal if we get in at the right time.
Yes, the individual, and there are many, but the one that I mentioned that was still smearing poop at 26 years old, he was an early on individual with vaccine damage. And at that time, people weren't recognizing the damage and where it might have come from. The detoxification methods were very few. The supportive methods, we have learned a lot about how to help heal the neurological system, dealing with emotional things, therapies. It's been a learning curve. We're still learning more all the time.
Many of these children, including my son, were very sick, very medically sick.
Yes.
And we would go to the doctor, and the doctor would say, oh, it's perfectly normal for a diagnosis of autism to have diarrhea, to have your stomach swell, to have your hair fall out, to walk on tiptoes. And by addressing the gut, if you like, we have managed to sort a lot of that out.
Absolutely. Thank you for bringing that up. You know, they say, oh, it's normal. No, it's not. It's common. Common and normal are not the same definition. And out of the 200 individuals that I had in my practice, every single one of them had what we would call gut dysbiosis, which means the good to bad bacteria was off. They had what's also termed leaky gut. Healing the gut was one of the very first things that I did with any child, any individual. Some of the people who came to me were already young adults. And with proper interventions, obviously the earlier the better, but with proper interventions, people did have a certain amount of healing. You know, what we call functional is relative. If you have a child who doesn't make eye contact and has no speech at all, and then he comes to a point where he has 20 words, makes eye contact and can interact, can read facial expressions, that's a much higher level of function. my goal, and I think all the parents that I dealt with, their goal was to have their children function at the highest level that they possibly could.
Many parents, like myself, we got our fingers burnt trying to so-called cure our children.
Yes.
There's a lot of people out there selling remedies and bankrupting the parents,
Yes,
taking
that's sad.
advantage of us with endless supplements and things like that. How do we know as parents who to go to, because the mainstream white coat doctors will not treat our children?
It is very rare to find, because it steps outside of their normal standards of practice. So it is rare to find medically licensed people who will treat. There are a growing band of integrative physicians and nurses, holistic nursing societies, homeopaths. Homeopathy was my absolute favorite modality for assisting after healing the gut. Again, each person is an individual, but in answer to your question, there are a number of therapies that are also very helpful. Music therapies. Those people who are legitimate have been certified. They have master's degrees. They've been certified to work with individuals. Again, we have much more available today. The children who were damaged early on, the parents were really on their own, and I can understand how you would feel burnt if you had, subscribed to whatever and it didn't help. There is no one size fits all, unfortunately. But trying to work with someone who is certified, hopefully licensed, has some backing behind them, and thank goodness we have more of those search engines available today where we can look to see, is this studied? Is it? And by the way, studies have been done, many studies. Not all of them get published in peer-reviewed journals in the medical society because they're blackballed and they just don't get published, but they're out there.
Now, what about diet? Because for my son, it still is to this day key in his behavior.
Yes. I heard that from many parents. There are a variety of things out there. Obviously, seizures is a big issue for a number of the people that I saw. And there are diets specific for reducing seizures. Migraines, I might add, are believed by many to be a mild form of seizure. And the babies, the very young children, they can't tell you that their head hurts, but they're screaming. It's because of inflammation, and they are indeed in pain. And there are diets that are helpful for seizure control, for migraines, certain foods to avoid, certain foods to add in. The things that I found, if I might add, the things that I found initially with the very first child that I saw, it was my third year in practice. I had never, as a mother or as a nurse or as a naturopath, seen such an individual, and I was stunned. I didn't really know what to do. I went back to my private office and I got down on my knees and I prayed. And I was led to the things that I did know how to do before I took those 6 years of additional training. And it is fats. It is getting essential fats because the brain is a fatty organ. Working with anti-inflammatories, there are a variety of things that can be helpful. Again, individuals are different. B vitamins. And I learned later, because again, this has been over 30 years, we learned later that not everyone absorbs B vitamins properly. If they have certain genetic markers like the MTHFR and the COMT, if they cannot absorb B6 and B12, then the good of those vitamins in supporting the neurological system is just not there. So we learned a lot. I did a variety of what would be called functional lab tests. I had a licensed lab on site, and we did send out labs. So I was looking for heavy metals. That was early on something that many people were alarmed about. Indeed, there were certain heavy metals that showed up. There are detoxification ways to help that. But detoxing wasn't always the answer, unfortunately, for every individual, because for some of them, I hesitate to say this, but the damage was done. The effects of the toxins, whatever they were and however they were ingested into the body or injected into the body, the results were already there. And then we had to work at building the body systems back up so that the person was stronger and had a better resistance to the symptoms.
And so what do you think is causing the immense growth in so-called autism? What are you hearing from the parents? And because we're at a critical stage now.
Absolutely. My personal belief is that there may be a genetic predisposition. Something has to turn those genes on, something that wasn't perhaps present 50 years ago. And there are many variables that could contribute to that. But what I heard from my patients repeatedly was an undeniable connection between the initiation of symptoms and the time of their well baby visit. And of course, we know what happens at well baby visits. People would bring me their children screaming, still screaming from the day before, 15 hours of screaming because of that inflammation of the brain. And they would say, but they only got 2 shots. No, they had 2 needle injections. But in each of those were several, and we're administering through the medical realm 7 to 8 vaccines in a day. What this does is taxes those little 8, 10, 12-pound babies to form 7 or 8 antibodies all at the same time. And there's absolutely nowhere in nature where anybody would ever be exposed to that many communicable diseases and forced into forming antibodies all at the same time. So that's something that was undeniable to the parents who brought me their children. And after they kept coming, child after child, I could not look at the parents, look them in the eye and say, oh, it's a coincidence. It has to be a coincidence, when I kept hearing the same story. And so I began doing more and more research and finding other like-minded professionals and parents who saw that connection.
Have you seen the cases, same parents, say 3 children or so, first child heavily vaccinated, second child partially vaccinated, third child no vaccines? Have you seen what that looks like?
Absolutely. In fact, one of the chapters in my book is specific to that. It's called My 3 Sons. I met a set of parents. They're both engineers, both intelligent, highly educated individuals. And as such, they trusted their pediatrician and followed the standard vaccine schedule with their first son. They did notice that he cried every time, and they were told, oh, that's normal, that's to be expected, give them Tylenol, it'll be okay. 14 months later, child number 2, all 3 were boys, by the way, and they noticed that he also had long periods of crying and was very fussy after his vaccines. Oh, it's normal, they were told. Well, as it happened, they took both boys into the pediatrician for their well baby visit on the same day. One was 18 months old and one was 4 months old. Both boys spent 15 hours screaming, just in obvious pain.
After the shots?
After the shots. Both of them received the shots from the same doctor on the same day. So then it clicked to the parents. They're like, no, this can't be right. This just can't be right. Well, after 15 hours, when the children went to sleep, the parents, exhausted, went to sleep. The next morning, only one of the children fully awoke, being the younger one. He was diagnosed with regressive autism. The older one, at 18 months, who received the MMR and the DTaP and perhaps something else, he no longer made eye contact. He no longer had facial expression, and at 18 months he was stringing words together. He had no speech at all after that. So the parents, of course, took them back to the pediatrician the next day, and oh no, they must have a virus. They're running a fever. They're fussy because they're sick. They'll be okay. There were no referrals to other specialists. Again, this was many years ago. It was early on. But the parents stopped vaccinating at that point. 3 years later, son number 3 comes along. He has never been vaccinated, and he, coming from the same gene pool, is completely neurotypical. All 3 boys are intelligent, I'd like to add. They're wonderful children, but they were left with one child who was more severely autistic. I don't know if I'd call him profound, but pretty severely autistic. I'm more mildly autistic. Mind you, all autistic children are autistic. Their symptoms appear to be more mild or more severe, But interestingly, yes, 3 children, same gene pool. It's the one that was not vaccinated that is neurotypical. And I had several such cases, usually with only 2 children. This one was 3.
Thank you for telling that. And tell us about this book and where people can get it.
It is on Barnes & Noble and Amazon. I'm writing a series of books after I retired. This one is obviously geared towards autism. It is a collection of stories, just as I shared there with that one. They are real stories, true stories, real people. And in the back is a series of notes and references so that people might find where they can go to, again, that was a good question you asked earlier. Where can people find legitimate sources of help? And this is not an exhaustive book. I am one little practitioner. I saw these children, these individuals, they kept coming, and I felt a need in my heart to speak for them. And that's why I'm here.
Well, thank you. Is there anything else you want to tell the people?
I think that it's important that all of us advocate, all of us that have seen, it is our duty to speak up. We need to let people know what we have seen. We need to advocate for the individuals who maybe literally cannot speak for themselves. We need to speak to the medical community so that they understand, because they're not necessarily trained to think anymore. They're trained to do as they're told and to stay within their pathway, their clinical pathways. And we need to speak to lawmakers so that they understand that they can help these individuals. They can stop the onslaught that what we've seen. And you know, I'm old. I had 3 vaccines before kindergarten. My children in their 30s had 18. Now it's close to 100 that children have. And one doesn't have to be a medical person to understand. Just stop and think. Might this be one of the variables? In my practice, I would have to say, and in what I witnessed, I would have to say absolutely.
Thank you. Thank you for this amazing interview. And for our viewers, just remember that Children's Health Defence does not give out medical advice, nor, in fact, is
Yes.
a doctor giving out medical advice.
Yes.
So there's that. But thank you so much for sitting here and educating us.
Absolutely. Thank you.